it's a challenge. You know, in Lubbock, there's a lot of monopolization, and that's been the strategy. None of this is about quality of care. None of it is about quality of physicians. This doesn't even figure into the equation in Lubbock. This is a totally different animal.
How do we fix it? What can we do? Let's talk locally. What could happen locally that would benefit the citizens that live in this block, the next block, on the east side of Lubbock, on the west side of Lubbock?
Very straightforward. Eliminate all network designations. Your insurance should be as portable and transparent as a credit card would allow you to buy gas at a 7-Eleven, a Citgo, a Phillips 66, United, wherever. You shouldn't have Health Smart in this town saying that you cannot go to North Star, Heart Hospital, Grace Clinic, Grace Hospital, whatever, but you have to go to Covenant or UMC. That would benefit every man, woman, and child in this community. Because then, with their insurance, they can go to the place where they get the most efficient care by reputation, by design. And I see this all the time. Patients will request a certain facility not be used. Let me repeat that. They will ask me not to take them someplace. That is unprecedented in my career of 20 years here. People would never ask, you know, where are you going to, they might say, no, where are you going to do my procedure? And I would say, we're doing this one at UMC, we will do this one at Covenant, we'll do this one at St. Mary's, whatever. And they go, okay. Now, they're telling me, when I'm in the same breath saying, I think you need a hip replacement, Mr. Jones, and they say, and you cannot do it at this facility. And I go, well, guess what? Your insurance says I have to. Are you kidding me? I don't have a choice? No. The public has no concept. This network idea needs to go the wayside. And that's for all insurance and all medical care across the board, statewide and nationwide. It saves nothing. Absolutely nothing. And it feeds into this power grab and this networking thing where there are certain physician groups that would then be funded by a certain population of patients, and that props up their little thing. Does it save money? Not one dime.
Is this the same issue of, or an expansion of this would be maybe the issue of medical necessity and the extent to which you make a judgment about what needs to be done, and then you might have to talk to someone like Ted Hartman and say, is this in the struggle that you have, having to second guess another practitioner?
No? Not really.
Okay.
No, those are separate issues.
Right.
And those are insurance-related issues. I got 3 denials today from Blue Cross. One on an ankle replacement, one on a cervical disc replacement, and another on a lumbar disc replacement. All Blue Cross denials. Now, that has, I mean, it's shockingly bizarre. Nothing in the healthcare reform addresses that circumstance. Nothing. Nothing. There is no mandate of what is covered, and there is, I'm just telling you, this is a ruse. The Democrat bill that just passed the House will do nothing to change the patient coming into my office and being told, you can't have your ankle replaced. You have to have your ankle fused. Oh, but you have coverage. Well, I have read, I've looked in literature, I've looked things up, and I think the ankle replacement has shown itself in Europe to be, over the last 15 years, very reasonable and very functional and very good. And I'd say, yes, ma'am, that's correct. She goes, well, I want my ankle replaced. I think, and I said, yes, and you're the age and the body weight and the characteristics, you'd be perfect for it. But you can't have it. Oh, but you're covered. Are you covered? This isn't going to change. Our public does not understand how they have been just taken to the cleaners by this bill thinking, oh, now we're going to be taken care of. Your problems are just beginning.
Dr. Carr, I know one time, many years ago, I interviewed you about how you came to learn to share a role with death, that in your early career, that there were limits to what you had to offer your patients. And yet, later in your career, you talked about how the technology evolved, that you felt trapped. If you didn't do certain procedures, which you maybe felt like you questioned how well it would be ultimately to the benefit of the patient, but you were afraid not to do them for being sued. Do you have any sense in our current evolution here? Again, I want to get back to this issue of putting the care and the control back in your hands as a physician. Is this still part of the dilemma of how we try to provide care, but we don't we talk about defensive medicine, we talk about all that other technology. Is this still a struggle would you feel comfortable today in saying, I don't want to do that, or I don't want to do it that way, knowing that somebody may come after you and sue you?
Well, this is one of the things that I can perhaps emphasize a little bit more of the value of that from what happens whenever you have a premature baby. If a premature baby used to be born, and the youngest one that lived under my care weighed about 1.75 pounds when he was born. But any child under 2.5 pounds used to be, with the techniques and the modifications we had to help these children, used to have a maybe 10% chance of making it into a normal childhood. And so when it came out that we began to get so that we could take care of these children that were younger, because of the evolution of techniques and so forth, when you felt like even though it was 10% or 15%, you had to do everything you could do, even though you knew that a good percentage of these children would have brain damage when they were born, when they were adults or children. So therefore, you had to do everything that you could possibly do for any child, no matter that was born alive, no matter what the weight of that child was, no matter after you even explained about the dangers of brain damage, brain not being developed, or any other problem as far as the child having lung problems and so on the rest of its life. And so it got so that no matter what, you tried to do everything you possibly could, which even then involved a lot of techniques that were extremely expensive. And then you might end up with a child that was retarded and so forth for life. And but you felt like you had to do it, because if you got sued one time, or somebody came along and told you you didn't do everything you should have, then you might be found at fault because of the baby, and you had to do everything, which therefore you did. And it's just one of those things that increased the cost of medicine tremendously and gave poorer results than you had before, certainly no better results than you had before. And so it's just one of those things that I couldn't see how, if you had all the money in the world and everything like that would be great. But money was involved. It took away care for the child that had a better chance of living. And so by trying to save and do everything you possibly could so you would never be criticized.
So one of the issues, though, I think, is you talk about that you're covered, but you're not allowed this particular procedure, even though in your judgment that's the right one. And so here we have this goal of cost containment. Now, again, Dr. Hartman, I would say that as a person who on the end of it under medical utilization, how did you steer through that process of saying, well, we want to be good stewards of our resource, but we need to trust the physician that they have some idea about what's needed?
Well, I spoke up a good many times on behalf of the physician making the decision, because that's the way it has to run. It simply has got to be that way in order for this thing to work. The corporation cannot make that decision. It doesn't fit. And Blue Cross, at that time, the head of Blue Cross was a former family physician, and he did listen. If we took it all the way to the top. And we were able to get some of the things through at that time.
Do you see that as when we talk about how we're going to pay for some of these new programs, and there's this idea of, well, we're going to knock out fraud, and we're going to have all these other things, but in a sense, is there a fear that practitioners should have about who's going to come in and look over your shoulder?